Governor Gretchen Whitmer made a stop in Grand Rapids today, urging state lawmakers to pass sweeping new protections for abortion access. The roundtable held with state and local leaders is a continuation of efforts that began after the U.S. Supreme Court overturned Roe v. Wade. In response, Whitmer and the state legislature repealed the state's 90-year-old abortion ban back in April. 13 on your side's Charlie Tinker joins us from the newsroom. And Charlie, bring us up to speed on where those efforts stand.
Well, Nate, the Reproductive Health Act, as it's called, will be up for debate in the legislature this fall. It's large, around a dozen bills in total, and so there's a lot to it with some disagreements there. I should note as well, very few, if any, expected votes from the House Republican minority. Those bills would scrap the current mandatory waiting period, which is 24 hours and requires what's called an informed consent form that would also be gone under this rewrite. The act also allows Medicaid to step in cases involving families who qualify as low income and streamline the process with regard to private insurance as well, then lifting certain restrictions on the clinics themselves, with Whitmer referring to some of the state statutes still in place as barriers that need to be overcome.
Our job now is to level those barriers, and that's why we can't stop. We can't think that the work is done, and we have to continue to be vigilant, not just in getting the RHA passed, but also thwarting any other efforts to compromise a woman's ability to make her own decisions about her body.
And as far as how this could proceed, in response to a question from reporters asking whether Whitmer would consider the bills individually, signing individual elements of this larger act into law, the governor said she didn't want to pick and choose. She'd like to see the whole thing on her desk instead, because each of them, she says, addresses a barrier to access. We'll, of course, update you as soon as those are debated. We have a better sense for the level of support they are likely to find as they do that.